I don't know if it's recording yet.
Yep,
it's just started.
Recording has just started. Great. Okay. Well, without further ado, I will share my screen. Can everyone see that?
Yes.
Yes.
Yep.
Great. Okay. Excellent. And just in terms of time, probably looking at 20, 30 minutes. Would that be right, Melissa?
Yeah, if we can, and we'll include some questions along the way. So I just need a couple of minutes at the end. That's it. So go till 10:57 if you want.
No worries. By the way, anything that we talk about today that you'd like to learn more about, I'm more than happy to come back anytime and we can run through other content. We can do more stuff. I can also catch up with your organisation individually too. So absolutely, that is available to everyone. So I'll jump into it. So thank you for letting me come along today. I wanted to talk to you about health literacy and some of the things I wanted to touch on, and there's a bit of content here, but I reckon we'll get through it all. But broadly speaking, I wanted to talk to you about what is health literacy. I want to talk about how we measure it, and also thinking about some tools we can use for better conversations. And there's a really great technique called Teachback that you may have come across before. And it's actually like a 3-hour module. We don't have time for that today. So I just wanted to give you the cliff notes and try and extract like the best parts of that. And so, yeah, about 30 minutes or so. But before we do that, I want to take you through a little quiz. This is an emoji quiz. And I want you to guess the musical artist or band. And we can do the first one together. This one is the Eagles. Okay, we'll do our next one.
Radiohead.
Run off mute.
Radiohead.
Guns N' Roses.
No.
Yeah.
Yes.
Is it?
I thought they were Chili's.
So
yeah, I was thinking Red Hot Chili Peppers.
Wait for it.
Smashing
Pumpkins.
The sweet,
Smashing Pumpkins.
Yeah. Smashing Pumpkins. Backstreet Boys.
Yes, Backstreet Boys. Well done. Well done.
Red Hot Chili
Peppers.
Nice. Well done, everyone. That was
Yay!
really fun.
I knew most of those. That makes
really
me
well.
feel good. Yeah. I was worried for a minute.
Always start on a win. So, first of all, yeah, I wanted to talk about what is health literacy. The first thing I'm showing you here is I'm showing this for a reason, right? Here's a slide which has some information from the Commission on Safety and Quality in Healthcare. And there's two types of health literacy we talk about. We talk about individual health literacy. And these are the skills that people use to access healthcare. And it's things like booking an appointment, knowing how to find information, knowing how to take that information and use it so it makes sense for us as well. And that's one part of it. And then outside of us, we have the health literacy environment. So that's an interesting one. These are all the systems and the policies and the processes and the decisions and even the buildings themselves that sit around us. And the health literacy environment is something that has a massive influence on whether we actually are considered health literate and whether we're able to make proper decisions for our health and well-being. And I'm going to show you a second slide, which is probably a little bit easier to digest. And I wanted to show those two different slides because we all learn in different ways as well. So here you can see this is a diagram of health literacy, and you've got the person in the middle. We're talking about their skills, their motivation levels, their knowledge, and outside of that is the health literacy environment. So that includes us as service providers, it includes our clinicians, the places where healthcare is provided, not just buildings, but websites and digital platforms as well, talking about our policies and procedures, and also health information. Thinking about My Aged Care and MyGov and all sorts of systems behind it that work, or in some cases don't work, to integrate and deliver that health information.
Chris, would you be able to share that one with us? That
yes,
particular,
yes.
I'd love to have a copy of that on my wall, would be great.
Yes, of course, absolutely.
Thank you.
Thanks, Irina. And it's interesting because health literacy first came about in about the 1970s. And it was this idea that health of individuals was getting more complex, more comorbidities, more specialized and more improvements. But what happened with that was our language got more complicated and our systems got more complicated. And there's this movement to say, you know what, we need to start thinking about this idea that as individuals, it's not our fault if we're not understanding information. It's not our fault if we're not able to get that and take that information, use it to make sense in our lives, there are other things going on. There's the entire system around us, and ultimately, health literacy is the interaction between these skills that someone has and the demand that the system will place on us. Who does health literacy affect? I know you're fantastic at quizzes, so I wanted to give you another quiz here. This is Who Wants to Be a Millionaire? So, the first question for $500. What percentage of people in Tasmania do not have the health literacy skills to adequately manage their health and well-being? Is it 1 in 5 people, 1 in 3 people, 2 in 3 people, or 1 in 10 people?
I think it's B.
Yeah, B
Yeah,
or
lock in
C.
B.
B or
I'm going
C?
to say C.
Yeah, B
So
or
C?
C. One
B
of
or
those
C.
two.
Okay,
Mm.
we'll aim for one of those two. That's your C.
Yeah.
2 in 3 people. So 60% of people don't have the necessary skills to manage their health and well-being. So we've got 3 questions here. Our second question for $50,000. Thinking about that same group of people with a university degree. So what percentage of people in Tasmania with a university degree do not have the health literacy skills to manage their health and well-being? Is it 1 in 5 people, 1 in 3 people, 2 in 3, or 1 in 10 people?
B.
I'm going to
Yeah,
go
I said B.
again. Yeah.
Yeah,
B, C, did you say?
I'm saying B.
B, yeah.
B.
Okay. Yes, 1 in 3 people. Isn't that interesting? So we think about, the skills that you might learn when you have a university degree. Usually it's around critical thinking skills.
Mm.
And that statistic, I think, is still quite surprising. So we have our last question here for $1 million. Okay, so you're a patient in the emergency department. A doctor tells you some health information and it's a diagnosis in terms of why you're there. On average, how much information will you forget immediately? Will you
Oh,
forget
God.
30%?
D.
80
80?
Yeah, D, I reckon
D,
80 as
Ada?
well.
in an
I reckon
emergency.
D.
Yes.
Yeah.
It is so scary. Yeah, the statistics found that when we're told something, we forget 80% of it immediately. And we can remember what's wrong with us, but we'll forget how to treat it.
Yeah.
And also in an emergency department, like we said, almost 80% of people didn't understand the information they were given, but they asked the doctors the same question, and about 99% of them said, oh, hang on, I gave the right information. So it's kind of crazy when you think about it, because most of us don't realize we haven't understood, and it's health professionals will overestimate our level of health literacy. And I know for me, something that happens to me still, I will go to an appointment and they'll say, like, do you have any questions? And I'll say, no, I'm all good. But then I come away thinking, why didn't I ask those questions? Like,
Yeah.
I've just forgotten what I'm talking about.
Mm.
And there's a whole heap of things that are going on in terms of why that happens. But
Yeah.
part of it is about, thinking we can't just give out information in the immediate, but we got to think about what do we want to give to people so that later on in a week, they're going to remember that.
Yeah.
Or, in a month. And particularly when someone's sick or not well, there's that whole other complexity going on.
Yeah. Yeah.
And so the statistics back that up as well. Here you can see the latest statistics from 2016 show that, 60% of people in Australia have poor health literacy. And in Tasmania, that actually bumps up to 63%, including 1 in 3 with a bachelor degree. So in terms of health experiences, well, I think we've all got a good idea because we are health consumers, we're users of the health system. And I think sometimes there are some really bad examples and people try their best. This is a picture that I found on Google. Look, I presume it's real, and I just really hope it's actually not, but look, I presume it's
let's
real.
hope so. Good for skateboarders.
That's right, exactly. Maybe the option is just don't get sick.
Yeah.
Maybe that's some advice, And at this location here, just don't have an emergency, is what this picture is saying. But there's also some good examples of good health experiences too. This is a young girl receiving respiratory treatment, and it's the first time we used animal therapy, which I think is a lovely little reminder
Mm.
of some of the small things that we can do that have a big impact. There was actually a study that came out last year where they talked to patients who'd received a diagnosis, and they got them to submit surveys, and they analysed the keywords from that. And they said, what is it that's going well for people? And the most common responses from 7,000 surveys was that 60% 60% of responses said that the relationships is what was important. And clinical care was 36%, and the actual environment itself was only 4%. So that tells us something real interesting, that people really appreciate when you pay attention. They appreciate when you communicate clearly and when you actively listen, and also that there's some emotional support and a human connection. So when we think about health literacy, it's not so much a thing that sits over to the side. Health literacy is a thing that should and can be embedded, in all the activities that we do. And it's kind of interesting because I talk to people about health literacy and I take the health out of health literacy. I say that if you can make health literacy changes, it's good for business, it's good for any sort of industry. But ultimately, like here, we want to be implying that in a sort of a health and a community context. And I think particularly in community services, this is important because we have organisations that work across areas that are not just health related, Someone comes in to get housing support, that will affect their health. So I try and almost steer away from health literacy, and I kind of talk about this idea of saying, hey, let's have good customer service and focus on good outcomes. In terms of how we can measure it, I'm just doing a little time check, 10:25. So there's a few things that we can use, and I want to show you quickly through a resource that we have called the Hello Tas website. And it's probably easier if I just show you the website itself. And I can come out to your organisation or come back again and go through this in more detail if you like. Very happy to anytime, but I'll just take you really quickly through it. So we were talking about this idea of measuring health literacy, and we're thinking about, well, how do we make these changes as an organisation? If we're time poor, we're stretched for resources, how do we make these changes so that people have a better understanding of their health? And we have a website that's designed to help you get a head start with that, and this is called Hello Tas. And this work is modelled on some work in New Zealand, which is around how to become a health literate organisation. And we've got 6 areas that we look at that sort of contribute to what would you, working towards being a health literate organisation. And basically a checklist that you can go through. But these areas are things that look at things like communication, so like our written communication, our information sheets, brochures, looking at things like access and navigation. So, when someone picks up the phone, what is that experience like? How many steps are they kind of bouncing through to get the care that they need? Or what about the physical environment, Are there any barriers there that are existing? What I'll do is I'll show you how the assessment tool works. So if I click on this here, on the left-hand side, you can see these different domains. We have those 6 domains that we talk about. And if I click on one of them here, I'll click on communication. And this is really cool. It'll bring up an interactive tick and flick tool where I can go through and do an assessment of my organisation. And it's asking some really straightforward questions, but these are really good things to generate discussion. So thinking about communication, we support our consumers by using plain language. We check our consumers' understanding the information we give them. So we're making sure that they understand. Are we using interpreters? Are we thinking that we've got physical environments that actually promote good conversation, like quiet areas and good lighting? And so as you go through the checklist, you're probably looking about a whole hour for all of the 6 areas. But you don't have to do that. And I actually encourage people to focus on 1 or 2, maybe 3 of these areas, because there can be a lot of work to do. But how this works is you go through and you tick the checklist. And I don't know if you can see, but on the left-hand side, the little, the percentage is changing as I'm doing that. And so once you go through the whole lot, you'll get a score for all of them, and you can click on your assessment results here, and it will actually plot it on a chart so that you can visually see how you're doing. This is a dummy account, this one set up, so I don't have all the results in here. But as you go down, you can see the results there. And what you would end up once you get your assessment results, it'll give you an idea of where you want to focus on. And I'll show you very quickly an example one as well. So if I scroll up to the top and I go to the resources section, I click here, we've got a whole heap of PDFs available that you can download, which will show you information about health literacy, an example report as well. There's some information about how to survey and talk to your consumers, how to assess your listening skills, and a whole heap of different things. But I'll show you tool number 3, which is the example self-assessment report. And this is what a complete one would look like. So you can see here, one person here has done an assessment. They've also got their team to do it and their organization as well. So that's the cool thing about this tool, is that you can get a few people to log in, use the same account, and actually compare results. And that can be really, really quite insightful because, for example, a senior executive might have a totally different idea to a consumer of your service.
That's great having those 3 in there. Very interesting. Yeah.
It is very interesting. Yeah. It's very fascinating. And so you can see visually here, this group organization, they're doing pretty good around involving their consumers and also their workforce, but they might want to focus on maybe their communication and maybe have a bit of attention around their leadership and management. Leadership and management is an interesting domain because that really talks about, is our board and CEO committed to health literacy, or do our staff kind of have to do it off the side of our desk? So it's really important that you do get some sort of buy-in because, as we know, with any sort of quality improvement project, it can be a lot of work. So we really want to have that buy-in there as well. Once you've got your self-assessment done, the next thing you can do is set up an action plan. And when you do this, I'd recommend to people, don't do it in isolation. It's a really good idea to have a small working group of 2 to 3 people in your organization to do this. Because like I said, if it's sort of lumped with one person, it's pretty hard to do. But I'll show you an example action plan. You don't have to use this. It's entirely up to you. Some people decide they want to. Some people are happy just to sort of take what they want from the audit, and that's absolutely okay. But I'll just show you quickly. I'll zoom in on one of them. So, here's an example. I'm going to look at dimension 4, which is access and navigation. What actions are needed to make it easier for people to find the information we have? People say they want to amend their signage. So, the tool has identified that, we need some work around our signage. That's the key action we want to do. And the key steps, we're going to review it. So we might have a conversation about it. That's when I can come in as well. Or maybe we might go to someone who's got some experience in how to do this. And then, you just follow the bouncing ball with the action plan. So who will do it? When will they do it by? And what will success look like too? So we're probably going to go out and talk to our consumers, get a bit of feedback around that. And we can actually survey them using one of the tools that we've got in the toolkit. You can do a pre and post rating. And so for me, when I look at that as an example, like if you were to review your signage, or even just your information sheets or something like that, that's a health literacy change. It's a small thing, but it can have a big impact. So we're not talking about complete service redesign. We're talking about making some small changes along the way. And that's what I'd really encourage people to think about, is that with all of this stuff, it is easy to get overwhelmed, and particularly when we think about action plans and all the things we've got on our plates these days. I really think that health literacy changes can be small things. And part of my role is actually catching up with people, and I can sit in on your meetings. I can help drive the process. I can support you as much or as little as you'd like through that. So it can be quite a big thing, or you might just say, you know what, I just want to focus on one thing here, and that's going to be like a mini project. And I'd really encourage people to sort of think about that, because once you get some wins along the way, you get this sort of a snowball effect, in the sense like, if you work on your plain language communication, for example, that will also flow on to things like your workforce. It'll flow on to how you're involving your consumers too, because chances are you're going to be talking to them about the feedback that you're getting around the changes that you made. So what I'll do is I'll just go back there. So this is the website in a nutshell. I've sort of flown through it a bit. But the cool thing about it is that you can download a PDF file of the entire toolkit. So this tool used to exist as a PDF, and it still is on the website. But there's all the information here about all the tools, the process to go through that, which you can look at as well. But I wanted to give you the the short version and have a bit of a walkthrough to show you that. So that's the Hello Tas website. And now I will jump back in to the presentation. Give me 1 second. So I've done the walkthrough. In terms of where to from here, like I said, free mentoring. Part of my job is catching up and supporting people through this. You know, I can attend your team meetings. I can come out and talk to your teams or your staff. I can repeat this presentation. I can zero in on some particular things you'd like me to talk about. And really, I'm just here to support you. So that's really my main role. Like I said, a few things that are really useful. Having a few people to drive it is really important. So not just having one person. Getting that buy-in as well is a good one from, you know, CEOs and senior leadership. Sharing responsibilities too. But also, I say to people, collect the small wins. So aim for service level changes, you know. If I was to try and roll this out, you know, across a whole government department, like it would be a mammoth amount of work. So instead, you know, I'm just going to focus on one area, one work area at a time. And we'd look at that. And then you can use it as a bit of a pilot to see how things went. And, you know, in big organizations too, teams will talk and sort of share things and go, oh yeah, we've been doing this health literacy work. And then you can potentially sort of scale that or move that around as well. So really focus on, I guess, just the area around you. The other thing I want to mention too is that it can be a lot of work as well. And people will see the nice stuff at the end, but also, you know, sometimes it's not all glamorous as well with quality improvement. But I just want you to know that like it is actually really rewarding to make these changes. And anything you can do to improve the experience for your consumers is going to be a win.
I love this graphic. It took me ages to actually process it.
It's good, isn't it? I like it. He looks quite happy too.
Good.
So that's the first part. I'm just checking time. We're doing okay. I might pause and ask, how did you find that?
Excellent. Lots
Yeah.
to think about. Yeah.
Okay, great. Excellent. Yeah. And that's the thing, health literacy is something that should sort of exist across so many different things. It's not a thing that exists by itself. And I think it's totally okay if like take this information, think about it, and come back to me, and we can make this an ongoing conversation too.
I
I just
posted
want
a
to
few
say,
links in the chat. Sorry, Emma, and Sue's put one in there too for an upcoming Titchy presentation. So that looks really good too.
Okay, great.
Sorry, Emma,
Thank you.
you go.
I was just going to say, I first connected with Chris about, I don't know, maybe a year ago or something, and had a look at this Hello Tas tool, and because we were really focusing on health literacy in our health navigation service. But since, I guess, getting that awareness, it's definitely filtering through the whole organization. And like you said, getting that buy-in from the board and the CEO, and now you may have heard Paul, our CEO, in the news sort of advocating for health literacy in schools, and working with Rosie Nash on
Yay, Rosie.
project. Yeah.
Yeah.
So it's I guess I'm just reiterating what you said about how you can sort of start small and then it sort of spreads. And yeah, it, like a year ago, it felt a little bit daunting to me to put our whole organization through like a Hello Tas tool, but now it seems very achievable. So yeah.
Fantastic. That's fantastic. Thank you so much, Emma. And that's wonderful feedback. And I've just been so proud of the work that St. Luke's has been doing. And this morning I posted something in our TasCOSS chat because I saw the news come out about the partnership and the trial with Health Lit for Everyone and Rosie and Chandel, which I just think is amazing. And I just want to say thanks to you for driving this work. And like you said, just putting the information out there and starting small and building that culture so that it becomes everyone's business.
Much
well
like
done.
your smoking cessation work. Lovely segue.
Exactly.
Start small, get everyone on board. Yeah.
Exactly. That's fantastic. I might move on to the next part, and I wanted to show you quickly about something, try and give you something a little bit practical too that you can use. You know, we're talking about this idea that you know, how do we sort of have conversations with people? How do we check to make sure that people are understanding things as well? And that's something that comes up in the health area a lot, but also, like we were saying, not just in the health area. Like I could be talking to an accountant and, you know, walk out that door and be like, yeah, no, I've just forgotten what they were saying, or I didn't use the opportunity to actually ask the right questions. So there's something really cool called Teachback, and I want to show you through that. So like I said earlier, I wanted to ask you, have you ever left an appointment and you didn't know what you were meant to do? Probably there was something going on. Did you forget what was said? You didn't understand? Or was information not clear? And this example is me, where the doctor asks me, does that make sense? And I say yes. And also me, I leave the appointment and I just forget everything immediately. So this is Bob here, but it could also be Chris as well. So there's a few things happening here. And like I said, this is not just a health context, but when you think about this, there's a lot of information going on. If you're at a medical appointment, there's probably talk about what's going on for you. So there's a diagnosis, there's talk about how to treat it. You've got medication, what you do when you get home, and how you're going to look after it outside of that appointment, what you need to do to follow up as well. And also when you need to return, what's going on there? You know, is that going to be a month, 6 months? How many appointments are you going to have? And let's not forget that we're talking about health here. So we're talking about potentially you're in pain or you're stressed, you're feeling tired. And it's also emotionally taxing and cognitively taxing too to take in all this information. So it's interesting because to me, this shows me that it's maybe not so much a medical concern or a medical issue. This is a communication issue. And sometimes it's more than just the words. Sometimes it's how we say information. It's why we say it. It's when we say it. So the timing's important. And also what we don't say as well. You know, I don't know if you've ever been in a situation where, you know, people sort of pausing when they're, or you're getting a scan or something like that, and the clinician's not saying anything, and you're like, ugh, why are they quiet? You know, why have they paused there? And we try and read into these things because it's information that's not shared. In fact, maybe they're just concentrating, but we don't know that. And also their body language. That's a huge component when you think about nonverbal communication. So Teachback is a really cool way that we can help our patients or our clients or our consumers make sure that we've explained things properly, and we're not trying to test them. That's not what it's about. This is about a test to see how well we've actually communicated. And so this is all about getting people to repeat information back in their own words. And it's about if I'm a clinician or someone, I want to ask someone, you know, instead of saying things like, "Do you understand?" or "Does that make sense?" I want to actually get them to explain back what I've said. And here's a few examples. So I want to make sure that I was clear about the side effects of this medicine. Can you explain back to me the things you need to watch out for? Or I can say something like, you know, people have trouble remembering how to do this. Could you just go through how you'll make it work, how you'll make it work for you? So you can see that Teachback is trying to avoid yes or no questions, these closed questions like, do you understand or does that make sense? And you'll note that I actually said, do you have any questions on my previous slide as well? But we want to avoid yes or no questions and just have an opportunity to ask someone to explain it back to them. This is important too because we know that people learn through different ways. People prefer written brochures. They prefer it if we write information down. You know, people prefer to listen to podcasts or audio or write their own notes. So it's really important that we sort of try and tune in to how people want information shared with them. And there's a statistic there that says that 97% of people prefer to learn by talking things through, asking questions, and then practicing as well. So there's a few benefits to Teachback as well. Firstly, we can understand what clients need to do and they can apply that information. It's better adherence to medication and lifestyle changes, but just instructions in general too. Again, thinking about accountants and lawyers, what am I going to do to do my tax return or whatever it might be? Again, this is not a tool just for health. Benefits for health workers. Melissa and I were chatting the other day about this idea that, you know, it actually reminds clinicians that communication is two-way. It's not just me saying, I've given the information and my job is done. It's very much a two-way street. And hopefully that also builds rapport and trust and just promotes a better conversation as well. Here is a cheat sheet, and I'm very happy to share this as well. And again, this looks like a bit of a wall of text, but what we want to do is avoid those closed questions like, does that make sense? Do you understand? Do you have any questions? And we want to ask questions about how someone will put that information into practice. So you can even skip that first part of those answers and just say things like, can you tell me, what did we decide today? Can you show me how to do this? How are you going to take the tablets when you get home? Can you just explain back to me the things you want to watch out for? When you get home, what do you need to do? And I like this one here. When you get home, what will you tell your family about what we talked about today? Because we know that's a big one, of course. 'Cause come home for an appointment. How did the appointment go? Good. What did they say? Yeah. Like that's also there. So I love that one. What are you going to tell your family about what we talked about today? Can you show me how to do this? Next time you come in, what do you need to do or bring? And maybe together, hey, let's write some notes down. And the last one I really like, what else would you like to know? So I like switching that one out. Instead of saying, do you have any questions? You can say, what else would you like to know? Because it's an open question. In terms of teach back, sorry, there we go. I've already said, what else would you like to know? Instead of saying, do you have any questions? And one of the things that we can do with teach back is we can actually pause after each point to give people time to consider what you've said and ask questions. And the irony of this presentation is that I've flown through it and I actually haven't paused. So a good technique in teach back is called chunk and check. So the idea is I give you information that's in a small amount of time, and then I'll pause and we'll check in and I can ask some questions. And then we can consolidate that information, move on to the next part. Obviously, because of the presentation, we couldn't do that. And I'm breaking my rules here. But, that idea of chunking information is also important. I think that as service workers, we probably do a lot of this intuitively. And I think there's areas that we do it well. And there's maybe areas that we go, I'm going to maybe try this next time or something. Would anyone like to share any feedback on what we covered today in terms of teach back, or does this resonate, or have you seen or heard this before?
Yeah, I think that I sort of feel that's the way we work. Yeah. I mean, it's a lot of counselling stuff to us, the summarising, the open questions. Yeah, it's great. It's really nice to see it all there.
Arena and Tina do this very well. I've seen them do this just naturally. Yeah.
Oh,
yeah,
thank
fantastic.
you.
I'm not surprised at all. It's so good to hear.
Sophie, you were going to say something?
Yeah, I was just going to say that this is a concept that's taught in all allied health qualifications, and it's the just wanted to say the link I shared is a build on from Teach Back. It's training that's just come to Tasmania last year, and it's been also integrated into allied health training in Tasmania as an addition to Teach Back. So those of you might be interested in this space, might be interested in the healthy conversations. It's an evidence-based way of presenting all the things that Chris has talked about today, in addition to this concept.
Great. Thank you, Susie. Yeah, I'd love to check that out. And yeah, absolutely. Thank you.
I'll include the link in the meeting summary that I sent out. Yeah.
Thank you.
Great.
Thanks.
Excellent. I might just, I know we've got 12 minutes to go. We have a really quick 2-minute survey. I would love if you're able to fill that out. You don't have to do it now, you can do it later, but it really helps us with our reporting and just showing that, we're delivering the content that people are interested in. And I'll put that in the chat as well later, but I might just stop sharing my screen. Oh, sorry. Just move to my last slide. I'll share my contact details in the chat as well if you don't have that already. But there's my last question. I said, is there anything else you would like to know?
Lovely link.
I think that's from my perspective, that was a really great presentation. I think it's also it's just such a reminder, and all the little tweaking we can do, because I do consider myself a fairly good communicator, but it's just so good to be reminded about things, and especially that thing of getting the person to tell you what they've heard. Sometimes we almost don't give that enough time, but and so it's just great. I really like the way you've presented it. Really good. Thanks, Chris.
Thank you. Oh,
Great.
thank you so much. That's really lovely to
great.
hear. Thank you. And yeah, absolutely right. Like just these reminders. And I think for me with Teachback, one of the challenges that I struggle to translate it is I don't want to come across as condescending, or like, oh, tell me what you learnt today. So that's the challenge, is trying to build that into a natural tone. And sometimes if we make it about ourselves and be like,
I was just going to
forget stuff
say,
all.
yeah, absolutely. Or even just saying to the person, I need to know that I'm explaining in a way that people understand. So can you, because it does come back to us. Are we?
Yes.
I like that. Yeah.
Absolutely. Absolutely. Yeah. And just on that too, like if you're interested in further training or anything else I can help or support either individually or collectively as a community of practice, we can look at like plain language design as well, plain language writing, and it's taking those principles again and just applying that in terms of health literacy, I guess, in terms of insights. Some of the things that I've probably observed in the last few years, written communication is such a big thing that a lot of organizations are zeroing in on. If people are coming to me and say, like, what are you seeing in health literacy land? Written communication is a big one. So we're talking about information sheets, consent forms. We hear about people that, chatting to nurses maybe and saying that, look, people are coming to our service, but they're not sort of, they're not reading the information we give to them before the appointment. And it's like, okay, well, let's have a look at the information. And and they know the problem. The problem is that it's a 10-page information sheet in size 10 font. And no one's got time for that, So there still has to be that human connection. Maybe one of the changes is, okay, we understand that the information sheet has to go out in that format. Maybe we have a plain language version as well.
Yeah.
We follow up with a phone call, hey, let's go through that together.
Yeah.
Things like that, where you sort of building that more in. It is more work. But, ultimately, if it leads to a better health outcome and a better health understanding too for people.
Yeah. It's challenging, really, I think, not so much from where I work, but thinking about medical staff and having the time to really do all that when people are so rushed. I mean, if you're sitting at a doctor's appointment, you can see there's 3 people behind you, they're running an hour late, and it's like, it's really, and I also sort of wonder about now living in the time that we do when there's so much information about everything and we hear so many words all the time and everybody's just getting tired across the board of words everywhere, which ties in again to how much and trying to get the essence of everything. And it's interesting for me. Sorry, this is a bit maybe too much information, but I'm actually going to have hip replacement surgery. So I'm going to see the surgeon tomorrow. So this is going to be, I'm going to use myself as a test with just what you said at the beginning, the home care, what I'm going to have a lot of info that I'm going to have to retain and how, so I'm going to, practice on myself with all this. It's all really interesting. It's Anyway,
Absolutely.
I could talk for hours about all this. I just find it all so fascinating.
That's great. Look, and I'm glad you mentioned that, Irina, because I think part of it is we have this experience as a patient or as a person. And, when you're sitting on that like hospital bed, you're looking up, all these things are going on, all these things going on in your mind, and all your education, your training, sometimes that just goes out the window,
Yeah, it's primal stuff.
It really is. It really is. And everything around us is so busy, so much data, so much information.
Yeah.
Let alone if you're there by yourself and you don't have a support person, So I'll be thinking of you and I wish you all the best for tomorrow.
Oh, thank you.
And
that's sweet of you. Don't worry. That was just sharing because it's relevant to this.
Of course.
But
it's also a big deal, But it's a big deal for all of us.
Yeah, exactly. Things are a big deal for people, even if someone says, you'll be put people individually. And I suppose that's what we're trying to tune in all the time, is to that for individual people and their particular circumstance. But anyway, it's all stuff you all know. So yeah.
That's okay. Good. Thank you. Suzanne, you mentioned that you've got you've done some work with information and consent sheet writing. We would love to hear from you if you've got any tips or ideas or would like to take us through something later on.
Well, what I'm happy to do is I can't work out how to put it on here right now, but I'll I'll send it to Melissa to share with the group. But a lot of the work I do, I mentioned in communities, is reaching the quieter voices who are obviously the low literacy levels. So in my last few projects, working in rural areas and trying to bring that voice in, and working with the getting ethics approval and plain language has always been a challenge. I use
Of course.
readability calculators, but I thought I could share the template of what ethics require and the version that we put in for approval, which I still feel is a bit, higher literacy levels. But I thought an exercise might be that, the group could then have a go at plain languaging it. And then I can, for future, I can go to ethics with a peer-reviewed plain language version of an information sheet, if that's of interest, because then that gives you an idea as well what's required from a research end to sort of go be provided to people.
Absolutely, yeah. Yeah, I would say it's definitely relevant, because if you can take it from that academic, and I know too with ethics, it's just sometimes it's quite hard and fast, in terms of what has to be written there. I personally think that'd be great. And yeah, if there's anything I can do to support or help that, just please let me know. And I'd love to hear from you, because I can talk about it from my perspective, but I love seeing examples that actually happen from people that do it every day. That's the benefit.
Well, I think I'm presenting coming up, but certainly of interest to the group might be that, like, the here and now research I'm involved with includes not only the vaping with young people, which inadvertently is going to be a co-design in a cessation pilot, but I'm also working on very similar research with exploratory and action research in rural areas for 15 and above, with the idea of smoking in general cessation. So I'm really interested in the work that's being done, but some of the group, or all of the group, whatever, may be interested in the progression of that. It's very early stages, but even of things to test and whatnot. So I'm happy to share anything that I'm doing, and anyone that wants to be involved would be amazing.
Yeah, I
think we'd like to get you up for April. Yep.
Yeah, I'm super interested in how you get the consent forms and all the legal requirements ticked off in a way that is helping people with lower health literacy levels. That's something that I've been working on, and I know there's still a lot more work to do. So
well, all of my research that I do is the same sort of thing, that connecting with quieter voices and working with people low literacy levels. So there's lots that I can share, and I don't even have to present every time, but I can share like slide decks of presentations that I've done, so you can have a look what's there, and then ask questions if that's of any use.
Fantastic.
Thanks, everyone. I'm just aware of the time. Yes,
Oh,
Irina?
I'm so sorry, I have to go. So I'm
Sure.
just going to thank you so much. Thank you, Chris. That was wonderful.
Absolute pleasure.
Loved
Thank
it.
you.
Look forward, if we can get the presentation too, could be really useful. Thanks for recording.
Definitely.
Nice to see you all. See you next time. Bye.
Bye. Good luck.
Thanks, everyone. Bye.
Bye.
I'll just okay. Jess, is there anything else you would like to know about today?
No, sorry, not from my end, but well, maybe actually, but I might contact you, Chris, directly in terms of how we could apply this with our school nursing team, because I think, not only really great for people with, age might be a reason why someone might be less health literate. So I think how we do our brief interventions with students, this would be great for our team. So I'll talk to you separately about that. Thank you. But no,
Absolutely.
other than that, good. Thank you very much.
Thanks,
Pleasure.
Jess. Tasha, anything you would like to add?
No, just thanks for all the information. I'm looking forward to getting on the Hello Tas website and having a bit of a good look around and seeing what it's all about, and go from there.
Great. Excellent. Thank you. And if you have any issues logging in or registering, please just reach out to me. I'm more than happy to take you through that.
No worries. Thanks very much.
Thanks for joining us today, Tash. Thanks, Simone. Anything else from you?
I really enjoyed that presentation. Thanks, Chris. Neighbourhood
Thank
Houses,
you.
we spend a lot of time in the health and wellbeing space, but predominantly spend a lot of time in the wellbeing. So I filled out the survey because if I didn't do it now, it would not have gotten done. And I just mentioned in there that we don't generally understand the health literacy. It's not the space that we generally sit in. We don't get the information from the clients. It's not sort of identified as an issue. It's not until we sit in this space and understand from service providers and people in the know that could identify that it is such a concern. It was quite shocking, to be honest. So yeah, we're really I'm looking forward to putting my team through the survey and getting us up to speed with the health Hello Tas stuff. I did ask for you to contact me, but that doesn't have to be a straight away. So don't contact me next week.
Oh, on the survey? Yeah, I'll get in touch for sure.
Great. Thanks, Chris.
Thank you so much.
That's great. Shireen, anything from you?
I think I have a bit of research to do, I think, on our end first, because there's quite a significant number of people that I'd need to, I guess, talk through with this. I think some of our departments are better than others at doing this, and I feel a bit like Emma in that initially it seems daunting because there's different people and different roles and knowing where to start and who to talk to. But I've got a bit of a plan in my head, so I think just bouncing that off you down the track once I've done a bit of research will be handy.
Absolutely. And you're not alone too. If you would like me to come out and do this again or talk to whoever it is, like I can run multiple presentations. Sometimes that's what we need to do. And often I spend a lot of time going out and just doing that and just talking about health literacy as a concept before we do any doing.
Yeah, no, great. Thank you.
Thanks, Shireen. Anything else from you, Emma? No, great. Susie?
No, just to thank you for letting me come along, and that was great to see that's getting out there, Chris, and see how Hello Tas has evolved. I actually sit right next door to Rosie. We're pod mates. So
great. Fantastic.
And nutrition and dietetics is my background. So there's a lot of food illiteracy as well that I've been interested in for many years. So it's fantastic. It's great to hear that getting out there and being a really user-friendly tool.
Excellent.
And just in general, it's really nice to connect with smoke-free community. And I recognise that my current research is vaping, but I made a couple of notes in there that the tobacco industry's intention with this vaping is to get kids back on smoking, because that's how they're going to keep their business going. We all know they've got to get them hooked before they're 18. So I've been raising that flag for some time, and the research I'm doing, I think, will bring that to the front end again, because a lot of young people are already reverting to tobacco.
Absolutely.
We talked about that yesterday at the coalition meeting. Yeah. Sorry, folks. Chris and I have another meeting to jump onto. Thanks so much for joining us today, and
thanks,
I'll be in touch about our April meeting. Thank you.
Bye. See you next time. Bye.
Bye.